Hi everyone, I'm Dr. Vivian Oputa. Welcome to Dermabites with Dr. Viv. Today we'll be talking about wrinkle anatomy. Now, wrinkles are supposedly signs of wisdom, but I'm sure most of us would rather do without them, right? Now, there are different types of wrinkles. The way they come about are different, and also the treatment, of course, is very different. For starters, we'll talk about fixed wrinkles. These are on the surface of the skin and come about as a result of the breakdown of the supportive structures in your skin. That's namely the collagen and elastin fibers. And this can happen if you're somebody who smokes a lot because the free radical damage will affect the strength and quality of these fibers. And if you're also exposed to the sun without wearing your sunblock, this can also happen. The lighter skinned you are, the more prone you are to sun damage or what we call photoaging as well. So you've heard this phrase, black don't crack, right? It's simply because the darker you are, your melanin, which is more active, protects you from the damage, the premature aging, and the rest. So the darker you are, the younger your skin remains because you have some natural protection from the photoaging. Something else we've seen a lot of is wrinkles as a result of abusing, let's say, bleaching products that are probably illegally prepared. Those that contain steroids, because the steroid ointments that they add to them thin out the skin. And you notice that people become really wrinkled. You see the thinning, you could even see blood vessels and stretch marks in some situations. So that's as a result of chemical treatment abuse, as I would call it. We also have dynamic wrinkles. Dynamic wrinkles are as a result of repeated facial expression. Like if you frown like this a lot, raise your forehead all the time, you're squinting, and so you might have an eye problem. If you have problems with your eyesight, I recommend you get glasses so you don't keep squinting because you build up the muscle that is responsible for the movement. Just like when you go to the gym and you're pumping iron, right? You see how you build up your biceps? So the same thing happens to the muscles in your face. So make an effort to reduce or reduce the animated facial expressions. Then we have treatments. For fixed wrinkles, usually wrinkle fillers are very popular. That's probably the first line. Depends. Sometimes you see crow's feet, so they could be filled up, and then some of the grooves on the forehead, etc., nasolabial lines. These are things that can be filled up. Then we also have treatments like chemical peels. If you do a deep peel, you can remove the surface, devitalize skin, and you can bring forth fresher skin. And then there are also supplements that you can take. Supplements like vitamin C, then your multivitamins, just things that will support the structure and integrity of your skin. For dynamic wrinkles, I'm sure you've all heard about Botox. Botox is so popular. What it does, it is actually a toxin, but it's a derivative. It's prepared from botulinum toxin, which paralyzes muscle. So when you inject Botox, it paralyzes the muscle so they relax and smooth out. So it's like you just get rid of those bunched up cracks and crevices on your face. So Botox is actually something that is quite popular, and it's temporary, so it has to be repeated periodically, probably 3 to 6 months, for you to maintain the paralysis. Then concerning wrinkles as a result of bleaching creams, the first thing would be to stop. But in some situations, the skin is so badly damaged that not much can be done. But at least for a start, you should stop using those creams because in addition to destroying the skin, the steroids are absorbed into the bloodstream and can damage your kidneys, your liver, and your bone marrow. So I hope you've learned a lot about wrinkles. If you need more help or you need some clarification, send me a message. Come and see me in clinic, and we'll take good care of you. Thanks for listening.